Live on the Golden Square Podcast.
Ooh, this is Linda. This is Barry. And when you come to the round table, you square off with the girl. Square
I hate when you do that. That looks so crazy.
Hey, everybody.
Hey, everybody. Welcome to the
Golden Square
Podcast.
With who? Linda and Barry.
At 7 Central, it makes it
I don't know what it makes.
7:01.
Oh.
Yeah.
How did that happen?
I don't know. Sometimes you can be so much fun, but sometimes you could be a real pill.
So, are you saying you're not having fun with me today?
I can never be with you and then have a good break.
Oh, okay. So, all right. So, how was your day?
No,
honey?
I'm first.
You're first.
Okay, easy. You
Oh,
too fast. So, Linda, how was your day?
Okay. So, Barry, I had a full day.
Did you really?
I did.
Did you?
I did. There was a lot of stuff going on. A lot of stuff.
What was going on for you today?
Well, a lot of stuff. I had to get my hair done. How about
and
that?
I like the new cut.
You like the cut?
Yeah.
All right. She's growing. I'm trying to let her grow back. I'm trying. But I have a great stylist. But anyway, I had to do that. I had to do some running around because you know one of my children went on to glory. So I was trying to do those kind of things as well.
Mm-hmm.
So I had a full day. So, hi, Mr. Barry. So how was your day?
It was electrifying. I had such a great day today, and I'm always feeling positive when I can wake up in the morning and know that I'm up and know that he gave me another day, one more day.
So when you get up in the morning, you hear those are your knees and stuff like that. So you
no, that's your house.
That's my house. Okay.
Your house.
I know I hear that
in my house
somewhere. I don't know. What is your house?
I hear nothing. No.
Oh my God. Let me tell you, just like my dad used to say, just keep on living, then you're gonna hear.
But to be honest with you, I don't hear the noises. I do feel the pain.
Oh,
Getting out of the bed, running to the restroom. It's a whole different thing when you hit 65, I tell you. But I'm feeling good. I mean, I think we look great for our age.
I think so.
Well, how old are you? What are you, 70, 80?
Not yet. I'm living and trying to live to get to those numbers. But I am planning a big 70th birthday celebration if God says the same.
And how many years is that?
I only have one. One more year.
Oh,
yeah. My birthday's in November, so it'll be 69.
This year?
Yeah, 69 this year.
And then next year?
And then next year, November, I'll be 70. 70 and 0. Let the math, come on. Bring the math in. Let it be math.
Okay, you're 3 years older than me, right?
You're 65.
Right.
Okay.
I'll be 66 and you'll be 69. Okay, so that makes you 3 years.
Yes.
Okay,
we good. We got all of that.
I got confused. Because you tricked me with that moving forward, like when I'm 70,
know. So I'm looking forward.
But I mean, I gotta say this though. I gotta say this too. You look amazing.
Oh, thank you.
It is so amazing to see beautiful Black women such as yourself who really take care of themselves. I mean, you don't look like you're 70 anything.
Okay.
So that's a beautiful thing.
Well, I thank you.
Even with the silver hair, you know what I'm saying? It doesn't.
I love
age
it. But
you
you know what's going on is a lot of women and men are going to the silver.
Well, the men have always been okay with it, more than women. Men have been.
Yeah, but there are some men that we have to say it's okay. Though. But it doesn't matter if it's little or it's big. There are some men.
It's the women who be tripping.
But we're a good trip. How about that?
A trip is a trip, nevertheless. Okay.
And a little bit is a little bit, nevertheless.
Stop it.
Okay.
I mean, I don't know.
All right. So I don't know, but anyway. So listen. Thank you for the compliment.
No, I wanted you to have that.
Okay, thank you.
I really believe, and especially since you are the epitome of what Black beauty is, and you represent well. I mean, you coach models, you do, TV shows. I mean, you are someone people go to
Wow.
for advice and coaching.
Yeah.
So to be a representation of what you do, it shows on your face that I would believe you came to me and say, I'm an agent and I'm looking for you. I would buy it.
But listen, can I tell the people about the exciting news I have for September?
Please do.
Okay, so in September, the last week of September, I have been invited to come to Sydney, Australia, and become their model coach for their event.
She's not taking me, but yeah, great.
I'm so excited. I'm actually trying to pack, and I never pack until the day of, but I'm trying to get it together now.
That's going to be a wonder. How long are you going to be gone for?
A whole week.
Isn't that beautiful?
Yeah, a whole week.
Don't forget to bring me back something now.
Okay, I will bring you back
I'm going to need that.
Okay.
I'm going to need that.
Okay,
you know? So you're going to be coaching who?
The models over there. And then I actually do a virtual training here, which I think the schedule, if I'm not, if not, I think my time for them would be like 6 o'clock 9 o'clock their time or something like that. And then it's 3 a.m.
Something like they're a big difference.
So big difference, like 15 hours. Yes. So I'm a night owl anyway. So I could go ahead and take a nap, get up and do that. So I'm really, really excited about
it. Is it the agency that brought you?
Yes.
It's the agency that said come on
and said, come on over. And like I always say to the models and everyone else that I speak with, you never know who's watching.
No.
And that goes for us as well.
Yeah.
Never know. Because when they asked me to do that, okay, go ahead, say your part. I cut them in half.
Yeah.
Okay, so when they called for me, when they said that to me, I said whatever he's saying. But anyway, I was shocked because I'm like, you want me?
But why would you be shocked? I mean, you're a good coach.
I think I really am because for one, I want to go inside. I can care less about the outside yet, but I want to know what's going on the inside to bring that out first. And then that could tell me where you're going and what I'm going to be doing. Am I going to have a hard job? But I love it. I love it with all my heart.
No, you're not going to have a hard job.
I don't think so.
And then
I don't think so.
What I appreciate watching you do is watching models get comfortable with you. I mean, I think you do a good job in getting them to where they need to get to. So, no, it's true. I've seen your work. I've been in another country watching you work. So,
see that?
Yeah.
So, but with all that being said, I got to get myself in shape. And I got to get in shape walking. And then because I walked with Barry,
but you did good.
Saturday,
yes, I'm not laughing anymore because you did good.
I did, yeah. I walked with him, and just like I tell models they need recurrent training, so do we.
We do
as model coach.
As coaches.
Yes. So thank you for that.
So thank you for being there. That was great.
I enjoyed it. I had a great time.
So we're going to want to know. So let me just do this little piece real quick. We're going to want to know pictures and everything when you get back.
Oh, of course.
Yeah, we got to have.
Of course. Oh, of course. We're going to have a whole segment about Down Under.
And kangaroos.
Yeah.
That should be exciting. No.
Okay.
No.
Okay, so let's get the show started. Let's get the show started. So,
Tori, are we ready to move on
with our guests?
We are indeed.
Oh, right. Let's make it happen.
We have a fabulous doctor on our show today, and he is incredible. Dr. Kahlil Martin. But he's going to give us a little story, a little background on why he goes by Dr. Kahlil, and I'm dying to hear that. Yeah. But he's doing so many incredible things in the community and for men abroad. He is a beacon of medical information and support. So I want to bring him to the light right now and introduce you a good person, a great doctor.
Can I say something?
Friend. Yes, please do.
And he's handsome. Yes. How about that part?
I know his girlfriend. Be careful.
Do that make him ugly?
No.
Okay, so he's still handsome, ladies. Let me just say, because to go to a doctor and he's good looking. Okay, now what you want me to do? Okay, so yeah. Anyway, go ahead. What you
She's
were
always
saying?
looking for a man.
I'm not looking for him because I'm making myself available for him. Did I say that?
Yeah,
Okay. All right. So anyway,
So we ready for our guests?
yeah.
I am.
See,
Hey,
I told you
hey.
he was handsome. Look at the smile.
Great smile. Great smile.
Yes.
Doc, can you hear us?
I can hear you just fine, and thank you. It's
Oh,
so great to be here today.
So, Dr. Kahlil Martin, I want to start off by really understanding the name. I know that you go by Dr. Kahlil.
Mhm.
Can you let our viewers understand why that's so important to you? And it was a great read on your bio, and I really wanted them to hear that because I thought it was exciting.
Okay, so we're having some difficulties hearing him.
Once again,
So
take a minute.
Yeah.
Yeah, keep that smile going. That helps us. So let's try.
He can hear us, but we can't hear him. So we need them to hear you. No sign language today. No. Sign language today. Yeah.
Audience, please give us a second. Our team is working really hard and diligently and making sure that you get to hear him. He's got some incredible things to say, and we definitely want to hear it. I do as well. So give us a minute. Give us a minute.
And what kind of minute do you need?
One whole 60 seconds.
Whole 60 seconds. All right, so tell me, so what do you have going on this weekend?
I'm coaching on Saturday, and then Sixth Position has their annuals recital, which is going to be exciting.
That's right.
Recital. So I'm excited about that. You know, so I can't wait. And that's gonna be that's Sunday.
Yeah.
And so my weekend is pretty full. So
but you know what? Tell the people about last weekend, because last weekend, let me just tell y'all, I did go, like I stated earlier, and I went to rehearsal with him, or walk, or however he wants to practice, whatever he calls it. But let me just tell you about this joke. He said, Linda, come and go with me. And I said, okay. And then I said, but are we inside or outside? He said, oh, we're inside. I said, well, okay. We were outside
in the heat.
It
was beautiful though.
It was.
Who was the group?
I went with
the
you.
Catholics or the other one?
I don't know.
The Q dogs.
It was some dogs. It was some Qs. It was some.
It was great.
They had a barbecue.
Not barbecue. They had crawfish balls.
Yes,
that was great.
And it was lots and lots of people there.
Yeah.
And the beneficiaries. Yeah, it was really nice. Mm-hmm. The only thing that I did not like that I was outside, and if I would have driven my car, I would have said, "See you later."
Nah, I would have kept it. She would have had a good time.
I did have a good time. I did have.
And then we had Mother's Day dinner.
We did,
which was delicious.
It was amazing. Yeah. So the whole last weekend was really, really good. Mm-hmm. I just it was 91 degrees today. And we haven't even gotten into June and July and August and all that.
I don't mind it.
I know you like.
Yeah, I do.
I did. Now I was gonna go see Barry today, right? Because he had a little something going on. He had a sale, and I'm like, "Oh, I'm coming." I said, "Hey, I'm coming," and he said, "Okay, come on." And then
5 minutes later,
I'm not coming. It's hot out there. I'm not even coming.
Ring. Hey, babe. That's what I said. She said, "I'm not coming." No, I'm not coming.
Oh, thank you.
Come on, Sixth Position is the way to go.
Yes.
Listen. We had a good time.
We did.
And that was Sixth Position, one of their first and many great endeavors to begin to then. Yeah. And I tell you, if you want your daughters to really learn movement and self-confidence, that's the place to go. Sixth Position does incredible things with young ladies, from dancing to etiquette to arts and craft to the body.
Yeah.
I mean, it's complete. So get them signed up.
And I was in her area in her
Yeah.
booth.
Mm-hmm.
I felt like a little girl.
Yeah, ballerina.
Yeah.
That
And
was
if
great.
I stand on my toes, something going on,
You
know.
gonna break
But but she had it set up so that you felt that.
Yeah.
That was the energy that
It was a good table.
Yeah, it was.
a good
Yeah,
table. It was a good table, good event, and good energy. So
Good
I did
energy.
like that.
Good
Yeah.
drinks.
What drinks?
Oh.
Oh, it sure was.
Oh.
Right. I wish I could give them a little plug because
But
I can't remember what it was. Was it the booth? Nah.
I don't know who it was.
No,
I
but it was
just
so
drank
good.
it.
Right.
Yeah, I was just-
But no, they had this wonderful sangria and this other little punch thing.
Together.
And you know me, I'm gonna put the two together and make a killer punch. And it was delicious.
good. It was good.
Yeah.
I had only 4.
It was a great event.
but
And
I wasn't driving.
it was a
so-
great event. That's all
Yeah,
I
it was.
gotta
It
say.
was really nice. It was the only thing I disliked was the heat, but there was nothing I could do about it.
No. Listen, there are people in Alaska crying, and you talk about the heat.
Okay, so now all I had a complaint was about the heat. They be crying, but I didn't want that heat though. I didn't want that
So
heat.
you think they got it together?
I don't know. So, Madam Producer,
How we looking?
how are we looking with our guests? Hello.
Is there anybody out there?
Yes. And who will be out there, Barry?
Our viewers.
Oh, hey everybody. Yeah.
Y'all want to do the 2 cents? I think they're still working on it.
No, because
our
we don't
2
want to
cents.
break that because
Mhm.
that's important for us.
Yeah. Our 2
Okay.
pence. Our two pence. Did I have something to drink?
No,
Okay, but let me
and
get
don't
something to drink.
and have something. Okay.
Let me
By
get
the
something.
way. Oh man, I'm so sorry. You guys would have loved Dr. Kahlil.
No, they still gonna love him.
Yeah, I guess.
Yeah,
so,
he's
'cause
coming
he's
in.
coming back.
Yeah.
Okay.
And he's full of excitement, energy. Of course, you've already seen the smile.
Right.
He so everything.
He
He
is.
is. He's everything. He's everything.
He's a man about town, and
Yeah.
I really wanted to get into that with him and really talk about.
But you know he came from Philadelphia.
He's from Philly.
Could you just imagine
Mhm.
him coming from Philadelphia
And went to Morehouse.
Yes.
And also went to Baylor.
Oh, oh, we've done our homework.
Right, we did.
We've done our
And
homework.
it's a Kappa.
Oh,
Did you know that?
I did, but they don't never ring a bell for me.
Oh, okay.
Yeah. I don't get into the sororities and the
And I'll say
Oh,
this.
man.
I'm gonna say this. And as much I'm with you on that, but I believe in social gatherings for empowerment. And I
of
think
course. And
if
I'm
they
there.
don't do anything,
They do
they're
that.
able to do that. All of them.
Yes.
You know,
Every one of them.
you know,
every one of them.
for fraternities and sororities. I think
yes.
they do a really good job in making sure that we empower.
Mhm.
So that whole crab in the barrel mentality is
It's out.
yeah.
Yeah, it's out the door.
So I do
Yeah.
I'm like you. I'm not.
I don't do them, but I do
I
support
respect
them.
them.
Yeah,
Right,
and I
right.
support them. I
Right,
support them.
exactly.
So, and they did a phenomenal job.
They
this
did.
past-
They did.
past
We had a
weekend.
good time. We
Yeah.
had a good time.
It was the only thing Linda Scott is complaining about is what
The
the
heat.
heat. The heat.
And there's nothing wrong
But
with
they
the
couldn't
heat.
do that. Yeah, they could do anything about it.
No.
I was under the tree, but I'm okay. So listen, I was under the tree. I probably had 4 drinks, and that helped the heat, didn't
I don't know. Did it?
it?
Did it?
that
4
had the
drinks
yeah,
and
4
heat for
drinks and
me.
heat.
I'm laid out. So I don't
So,
know.
And then yeah, that was the only thing. But it was really
I
good.
like the color on your nails.
You do?
I like that gray. That's pretty.
Never-
Yeah, she's gonna lose her mind.
Okay, I just want to make sure.
What we gonna do with her? What we gonna do?
Love me.
Okay.
All
okay.
right. All right.
So if
he's
we,
gonna go out and come back on his phone.
okay, how you know that?
Now,
I
No.
love you for that.
I know.
Because you don't have no computer.
I know that's what he's gonna do. So something happened. The devil got in the way,
And
we don't know.
He's not gonna win here.
He don't know.
We got
He
this
don't
under control.
so much under control. It's
Mhm.
fine. So you guys just, hey, ask Gary. Who is Gary?
I don't know your other friend.
Oh, I don't even have
A Gary in your
Gary in
world.
my.
But you sure threw it at
All
me,
right,
didn't
Doc
you?
is ready, family. Doc is here and he's ready.
All
We
right,
got it?
so, yes, bring him in. Bring him in. Bring him. All right.
Hey!
Back.
Oh, man, come on. Okay.
Oh, there you go. There you go.
We love that. We love
That's
that.
it.
Listen. Real quick, take us on a small journey on your name and the significance of Kahlil.
Please.
Yes. So my father and my mother named me Kahlil after Kahlil Gibran, a Lebanese poet, philosopher, and author. The further you get from my first name, the further you get from who I am. MD, that's what I do. Martin, we know that's a slave name.
Yeah.
It's Irish. I went to Ireland and saw Martin everywhere, and none of my genetics go back to Ireland, so that last name doesn't apply to me. Justin, it sounded good because my mom liked it. Kahlil means good friend in Arabic, and so so when you get to Kahlil, that's who I embody, and that's what I choose to be. So they call me Dr. Kahlil, and then I correct them. They call me Martin, but Dr. Kahlil.
We like that.
But that has such a good ring to it, Dr. Kahlil. Because I was going to say Dr. K. I thought that was like so.
Yeah.
Yeah, that's what I thought it was. I ain't gonna say what I thought it was, but I thought I liked it. I liked
It's
Dr.
interesting,
K.
but growing up, you realize folks aren't used to that name, and so they mispronounce it. So I got Cahill, Kahlil, all these kind of things, and my dad said, "No, you correct them." So
Right.
I corrected the Kahlil, but I also correct them on Martin now too, because I go by Dr. Kahlil.
Okay.
So give us a little bit on your journey now. We know you're from Philly. Okay.
Yes.
Tell us that medical journey. You ended up at Morehouse, then Baylor. Yes. Tell us that little journey for you.
So the journey started in the 4th grade. I went to a lecture by Ben Carson, the pediatric surgeon. He was speaking to my mom's work. She worked at Merck Research Labs in West Point, Pennsylvania. And so in the 4th grade, I remember this man, an African-American male, who they said was a surgeon. They said he was a pediatric surgeon. And great, but I saw how he took questions 6 at a time. So in a room, an auditorium full of scientists, PhDs, MDs, this pediatric surgeon was able to take very complex and intricate questions 6 at a time. He literally would say, question, and then answer each one in depth. And I know that's if you've had to answer questions 1 at a time, that's tough. But to see him do that, I said, I want to be like him when I grow up. And then it started there. So what is he? He's a surgeon. He's a doctor. Oh, I want to be a doctor. If you say it enough in a day, you start believing it. And so I said it so much over and over again. Then it started, well, you take this class. Oh, you do this. Oh, continue to work hard. Continue to help people. Continue to care. And that's where the journey started.
What is the medical scientist training program? What exactly is that?
So the MSTP is the MD PhD program. This program is for people interested in research and how scientific research translates into the bedside. So they call it bench to bedside. It's a very competitive program. There's a fully funded medical school tuition and a stipend. So in that program, you get both your MD and your PhD. And the idea is that these are people who are highly motivated, highly talented, who are interested in taking basic science ideas and moving them into application at the bedside. So bench to bedside. So my work at Baylor was in spinal cord injury and nerve regeneration. So people who had this was early 2000s, so Christopher Reeves was still alive, and our funding much of it came from the Christopher Reeve Foundation. So we were studying the overexpression of growth factors in the spinal cord to cause functional regeneration. What a great application. We take a basic science idea, and there's so much application in spinal cord injury. So folks who've had motorcycle accidents, transections, falls. It was to me, it was the ideal project to work on in helping someone.
Okay. All right. So
You got another one?
I have plenty.
Come on.
So
That was great, man.
I want to. So you're a surgeon, am I correct?
Yes. So I trained in head and neck surgery at Baylor College of Medicine, ENT, otolaryngology, ear, nose, and throat. That's head and neck surgery.
All of this.
All of the top
All
part.
that.
Okay.
But
So how long have you been practicing this and what
I've
do you like
been
best about it?
I've been in practice for now 13 years. My practice has evolved over time. There's been, I went into ENT, otolaryngology, and head and neck surgery interested in facial plastics. Meaning, and because my PhD work was nerve regeneration, and that's actually very similar to ectoderm. It's all the same principles. Now, as your journey has it, that I wasn't chosen for a fellowship, and the tough part is, as a student, you're like, you think that's the end of the world, but when you kind of see things from a bigger perspective, this is part of the journey. So basically my journey went into back to the hospital as an emergency house physician. So I was the person that you called when people would have a cardiac arrest and they needed me to resuscitate them, put an ET tube, an endotracheal tube in them, and resuscitate them. So from that, I moved into a hospitalist group. And from that hospitalist group, we're now taking care of patients who are in the long-term acute care field. So these are people who've had surgery and now they require long-term care. They're on the ventilator or life support. And we bring them and wean them from the vent. So the journey, it was one of those direction changes, but I realized they can never take away your experiences. So to this day, I still use the experiences in head and neck surgery, in emergency house physicians, and in airway procedures. And also now I work in endovascular work with dialysis. So folks who are on dialysis, we do procedures to open up their accesses to make them be able to have dialysis.
But let me go back to the head and neck, because I want to know, how do you help patients manage fear and anxiety before surgery?
Oh, wow. Absolutely. That's a great question. Fear and anxiety are a natural response. What I did and approached patients with was compassion and understanding. You try to put yourself in their shoes, see the world through their lens, all the way to the way you approach them, the way you interact with them. And I'm actually speaking about the pediatrics, because at Texas Children's, we did a lot of tonsillectomies and adenoidectomies. And so now you're dealing with children who have to have this quote unquote scary procedure. So the children are pretty self-contained and somewhat fearless. It's the parents they're the ones that they're having all the anxiety. But when you approach them as a human being, when you approach them with understanding, when you answer their questions, when you communicate directly, when you remember that they're coming to you for a service, and you're there as the expert, and you team up with them, I think that's what we've overcome some of the fear and anxiety. You humanize yourself, because you'd be surprised at what people think a physician looks like in this society. You'd be surprised at what people have an envision of what a physician is. And so when I pop in, hey, they may not realize that, but at the end of the day, I reach them as a human being. I put myself in their position, and we had great outcomes. And so, and it's a bedside manner. It's remembering the science, but it's remembering the patient. It's remembering we don't treat disease and illness, we treat people. And remembering that, I think, is what allowed us to address the anxiety and fear.
That was good.
That was good.
That's the truth.
Well, and the reason that I asked that question is because I have that white coat syndrome. So when I see a doctor enter in, I am done. I'm crazy. So I wanted to know, how do you make us feel at ease?
So it's funny. It's taken some time, because and we talk frankly. I mean, I feel like we have an open forum to talk about the higher stuff. When I walk into a room, you'd be surprised that people will read my scrubs and then ask if I'm the nurse, right? And there's nothing wrong with nurses. The nurses are the front line, but we've been conditioned in a place where the young African American male, youngish, isn't first seen as the doctor, right? And so overcoming that first conditioning, sometimes over time I've learned to crack a joke. Sometimes I've learned to be a little bit self-effacing, just to humanize myself a little bit. But when you get that, when you humanize yourself and you interact, the classic is they'll say, "You're the doctor," and I say, "Well, the scrubs say that, so we'll go with the scrubs." And they're like, "Ha ha ha ha." And then they say, "Well, you look." What they want to say is, "You don't look like a doctor." Then I want to challenge them and say, "Well, what does a doctor look like?" And we know what we think the doctor looks like.
Right.
But then we say, well, they'll say, "Well, you look kind of young to me, doctor." I say, "Thank you." And then they'll say, "You remind me of my son." And then if it's a female, "You remind me of my mother." And I love my mother. And now we start talking about, oh, now we're having references to each other.
Right.
And from there, you show your competence and your capability and your caring. And it's unfortunate in our community, it takes a little bit more. You'd be surprised if you'd ask me who are my most challenging patients. I can tell you, but we can talk about that in another conversation if we have one. But it's humanizing yourself and really putting yourself where they are. And sometimes you have to break the ice. It's with any interaction, any relationship. There's an icebreaker, and then you realize, oh, we're not so different. I'm here for you. I'm here to serve you. I'm here to help. We're on the same team. We have God. God is leading us. Let's go together.
That's good. That's good. I like that.
So, but my other, I had so many questions that because I'm not medical inclined. I'm gonna just let the world know that. So that's the part that I'm ignorant at. I'm ignorant at that. However, that's why you're here to educate me. But I wanted to know, like, what's like the common disconnect or whatever.
I understand. The disconnect is the distrust. The disconnect, and we'll speak more in our community as the African American in America. The disconnect is distrust. We have endured a history of unsanctioned procedures. We've had to know the history of the medical profession and the history of obstetric gynecology. Enslaved African women were used as test subjects without their consent by Dr. Sims. And well, you do your research on this. So there is a level of distrust that happens. The Tuskegee experiments, we've got people untreated with syphilis through the 70s. Now we're talking about 40 to 50 years of this stuff. So there's an inherent distrust. And so when I can recognize that and say, okay, I understand we don't trust someone, but now how do I gain your trust? Oh, let's find our commonality. Let's find our bond. Let's see that I'm here for you. And when we overcome that mistrust and distrust, then people are open. And a lot of the times, I do speak and practice a spiritual practice. And spirituality to me is a connection between individuals, you and I, and all your viewers, and a higher power. And we start at that basic level. We start at that basic understanding. There's a common ground. We all come from God. Let's start there. And so whatever history you have, whatever situation you're in, whatever day you've been having that day, we can let it all go aside and say we have something in common. Let's build from there. And we do, and we do. And so where there is that mistrust, distrust thing, at the end, it's Dr. Kahlil. and they enjoy that. You can't laugh at your own jokes.
But for me, I really want to know what can we do and put in place when it comes to Black men in the South and the doctor. I know that a lot of men who I've spoken with are challenged when you talk doctor to them. How can we fix that in our community to make men want to get their prostates checked and want to get their colonoscopies? And what is it that we have to do as a collective group to make our brothers more comfortable in knowing that it's okay and it's safe?
Absolutely. And I do. And I like that question because it references a previous episode that you had. I thought was very insightful and a great conversation. What I want to do, what I personally do, is build a relationship, right? We don't start with, well, here's your condition. Here's where you have to go. Say, here I am as a person. we build a relationship. And from that relationship, show your competency, show your caring, and then we talk about the science and what we can do to help. And so for as Black men, and I can't speak for all Black men, but I can speak for the men that I've encountered and as a Black man, with that, we build that understanding and trust. And then we say, well, you know what? I don't know everything. I've come to you for help, so let this person help me.
Right.
There has to be a lot of ego management in that.
Okay.
There has to be
Yeah.
a lot of,
Right.
this toxic masculinity that happens. You'll see the toxic masculinity comes from so many folks are just, they're insecure inside. But
Right.
we can help.
Right.
We can help by saying, you know what, you and I, we're the same. You've come to me. Let me help you. Right. And it's easier. I say it's so matter of fact, but it's got to start somewhere. And then it's a choice. It says, you want to be this strong person for your family. You want to be this. You want to be this successful person. We're gonna put these things aside and say, well, to do this and be present for my family and for the reason, then we're going to need to get this together. And we're going to need get our colonoscopy. We're going to have that prostate exam. We are going to have regular checkups and examinations. We're going to have to put all that ego and these conditioned ideas aside, because we're conditioned this way, and it doesn't benefit anyone. Right?
No, it does not.
At all.
Recently, you spoke with a group of men.
Yes.
On what exactly, and what was that experience for you speaking to a group of brothers?
Sure. So as a proud member of the Kappa Alpha Psi Fraternity Incorporated, I was able to speak to, and I had the honor and privilege to speak to the men of the Houston Alumni Chapter. I spoke on prostate cancer. Now, I'm not a prostate expert. Again, you heard my background. I'm in head and neck surgery and hospitalist work, but I became an expert. And it was interesting because I was able to teach and get buy-in and have an understanding from information that I wasn't presented in med school. I was able to present information on diet. I referenced the China study, and a very dear and beloved person in my life brought me to that book. And in that book, the China study, it looks at the role of diet and its effect on disease processes and its reversal. So now you have a physician who's saying you can take control of your life. You can take control of your situation. You don't have to surrender everything to healthcare and medicine that you don't trust. You can trust in what you put in your body. And so when I took that approach, you could see the energy just kind of shift in the room. You could see the men begin to listen. Oh, my diet, I can affect my prostate in the diet. So then we bring the data and statistics. And so we really delved into the role of dairy and dairy products and how detrimental they are to prostate health. The role of calcium and phosphorus. So you start thinking, well, I turn on the TV and milk. We grew up in a generation of milk. It does your body good. It actually does it. But that's very commercial. You have to look at when you see people and who they have being spokespersons, celebrities, and milk brows and all this nonsense, puppets. Then you have to ask yourself, forgive the noise. You have to ask yourself, if I can take my diet, and my diet has been shown scientifically, Dr. Ornish in UCSF from 1998 to 2008 did a series of cohort studies looking at the role that low dietary milk products has decreased the incidence and progression of prostate cancer. And then you can say the first thing you do is cut out dairy from your diet, and we can lower your PSA. That's the prostate specific antigen. That's the marker we use that says what's happening to your prostate. If we can do this, now you don't have to surrender yourself to something you don't understand. You're taking control of your body through what you put in it. And that was a very telling, because my goodness, you gotta drink your milk. Kahlil, you don't drink milk. I mean, I heard that growing up, but reaching folks on that level and bringing information that was actually new to me. We're not taught this in medical school. Now, I was in medical school now 20 some years ago, but we were talking about the treatment. We were talking about the surgery. We were talking about the radiation, all these too late methods, right? Versus prevention, versus lifestyle changes, versus things that we can do every day that has scientifically been proven to reverse disease states. Now, the prostate is just the tip of the iceberg, but that was a great example that reached these men. And so now we have an opportunity to speak to many more people on a more national level on the role of diet and any topic, but they don't realize that a health topic is just a starting point for a larger conversation as people, as Black men, but as people.
That's good.
And
That's
Black
good.
women, and all
That's
women.
good.
I was that was my next one. What about us? Because I know my doctor told me a couple of years ago, because I was gotta have my milk. I could drink a gallon of milk in 2-3 days. Done. That's how much. But then he told me to stop drinking the whole milk and just go to like what I drink all the time? Almond milk.
Mm-hmm.
Yeah.
So your doctor is telling you we all have a better in this Western diet, and we have diseases of affluence from a Western diet. That is an animal-based diet, and this is very well described in the China study by T. Colin Campbell. When we use an animal protein for our nutrition, the incidences of heart disease, diabetes, and cancer, these are colorectal, uterine, breast, prostate, is statistically significantly higher than those in a diet, a whole foods, plant-based diet. So that's telling us that when we say stuff like, well, that's in my family, I've got breast cancer in my family, they gave me the BRCA gene, and now I'm going to have a prophylactic mastectomy, the data says that's not necessarily good management anymore. When early stages of these disease processes, we can halt and reverse based on our diet, what we put in, we eat. And the very interesting part is when you say, well, it's in my family. If you take a cohort study of people, say we're now in Eastern or non-Western diet, and then we compare them and bring them to the West, they now take on with the same genetics. They didn't change when they crossed the ocean. Their genetics didn't change. But now when they're in the West with this Western diet, they now take on the disease profile of a Western diet. So now we're not saying it's not your genetics anymore. You can't say we can't. Oh, it's in my genetics. Now it's your lifestyle. It's your lifestyle and your nutrition. Very eye-opening for me too.
Yeah.
What about the kidneys? What about the kidneys? Because I know they say once they go bad, you can't heal them. Is that true?
Sure. So the saying of the kidneys is that your kidneys can go down to 20% of function. You've got two of them. There are people who live full lives with one kidney. After a kidney transplant, that's what's one kidney. They're living on one kidney. Your kidneys are very robust organs. They can go down to 20% of their function and still have function, happily function, live a full life. So we need to protect our kidneys, obviously, but we also, not with just our diet, but then these physicians have to be careful of the medications we're giving, because these medications that we're giving, we're people who, after the Rockefellers then bought up the med schools and then changed the curriculum and took away from a plant-based, remedies that, God gave us everything we needed to a pill, and funded Merck research labs and changed how we were taught physicians and healers. Now we're lost and say, well, this medicine that I'm giving you is killing your kidneys. I can cure this, but now I'm going to kill my kidneys.
But now your kidneys
one of the first things they'll say is, I'll tell my pages, I'm a minimalist. Let's go through your medication list. Let's not have polypharmacy. Why are we having two medications doing the same thing? And this is it's not heresy. It may be heretic in maybe the Paleolithic age of healthcare, but let's be honest. Let's understand that we don't run to a pill. We can do lifestyle changes. We can preserve function. The kidneys are very robust organs. Let's protect them. Let's do renal protection. Avoid nephrotoxins. Limit the alcohol. Limit the drugs. You like that one?
Yeah, we do. Yeah, we
I know
do.
you did.
What?
So if somebody wanted you to come and speak on the issues that you just talked about, how do we get to you? How do we make that happen? How do we get you in the room amongst an audience?
Yeah.
Should I crack a joke or answer? Okay, so no,
Both. Do both.
Okay. See my agent. The stop. All things go through. Okay. So in all fairness, I'll share my email. Hopefully we can. There it is.
Yes.
We can connect with a specific question, and I'm open to it. I love the conversation, and realize the conversation is not to replace you're going to your physician. The conversation is to be an opening, to be the opening act of something, to be a bigger conversation of our existence here, and we're here for each other. So I'm always pulled for it.
It's beautiful because the conversation is really designed to really help us to take charge of our own health. Like the biggest issue sometimes is that when we go to the doctor, we feel to ask the questions. Either we're intimidated or we just don't know what to ask or say. And the more conversations we have like this, I think it becomes more comfortable and easier for us to sit before a doctor and say, well, doc, this is my situation. What do I need to do and change? And begin to ask those questions. So this kind of dialogue to me is paramount for the future of our better health.
And since he said that, I wanted to ask, so how do you think in the next 10 years doing surgery would change? What would make it better?
Well, it's already changed. Now we have robots. We have the machines that are replacing the human hand, the steadiness, the precision. We know that. We have the AI revolution where we've got AI diagnosing. And they say, well, oh my God, AI is going to replace humanity. I mean, it might, but not if we evolve. And what I mean by there's nothing can replace the human spirit. You can't code that. You can't put in binary. You can't put it in a computer or a laptop. It's the spirit. It's the experience of being a human being. We're creators. We come from the creator. So how medicine will change, who knows? We know what technology is allowed to do, and we know that we've got Da Vinci machines doing surgeries and microsurgeries, but who knows? But I do know that as long as we continue to evolve as people, as human beings in God's image, we have absolutely nothing to worry about. We have sky's the limit. But the problem is we've now surrendered ourselves to this technology. We've surrendered ourselves to someone else doing the heavy lifting, and then our muscles get weak. Right? If your brain doesn't do the heavy lifting and you've got something doing it for you, what happens to your brain? It gets weak. It's not a muscle, but it gets weak. So as long as we make it ourselves and say, this is fine, this technology, use the technology, but let's evolve as people. Let's evolve as human beings and be here for each other. Because there's not been one AI that's been able to do that.
Right. Well, that was good. So listen, it's that time.
Yes.
It's that time. But Kahlil, Dr. K, let me just say Dr. K because I want to give you a response. But we have to bring you back because of the difficulty that we had in the beginning, because people need to hear more from you. Exactly. We need to do that. I don't know what that says. So you have
very informative. God gives us all that we need. Plant-based is a real conversation. I'm amazed to hear physicians speak of natural and preventative alternates to medication. Love this guy.
Okay. All right. So we loving you too. So again, we have to bring you back. I can't. I have to look and check the schedule. You have to come back.
Yeah,
you
definitely.
Yeah, you have to come back.
And when I come back, will you allow us to maybe have a different venue? I came live on location in Sugarland from Rupert, but I know we can have eyes on the prize. We can have a lot of eyes on this situation because you've got something very, very special here between you two, and the energy you bring in your conversations. I would love an opportunity to open up a different world and say, well, we have more eyes on what you're doing and what your vision is. Will you allow me to do that?
Talk to our producers.
Right.
That's a good.
Okay.
That's possible.
Yeah, we just have to get with our producers. We don't do anything without them. So
excellent. And you've got wonderful producers who did all the technical difficulties. You had wonderful producers. They were very patient with me. You know, I a little bit, but yes, thank you to your producers. You know, kudos.
Yes.
Well, thank you to you, sir. We enjoyed you. And we're really excited about bringing you back because there's so much more that you could help our community with when it comes to better health. You know, and
I'm here for it.
Oh,
Okay.
All
I'm
right.
so glad to hear that.
Yeah, so we get the
Thank you.
messages. I just can't see, so you have to do something about my eyes, okay? All right. Anyway,
Okay.
but
Very
it's
good.
okay. We don't go away. We'll be back. We're gonna hold you, and we'll talk a little further because we got to get some other things with you. But
Okay.
everybody, you know how to reach him. And if you're looking for someone to be real with you and speak to you about medical, it is Dr. K. So we look forward to seeing him again.
Which we do.
And
That was
this
great.
was awesome. We just didn't have enough time,
Yeah,
but
we need more time.
we have to go into.
We got to bring him back.
Yeah. So we go to our 2 cents.
Yes.
We
Okay.
have to go into our 2 cents. Our 2 cents.
Our 2
So-
cents is very. It's a little emotional. We
Yeah.
lost a queen this week. Was it this week?
This weekend.
This weekend.
Mother's
So
Day weekend. So
yeah.
that wasn't good for me.
No. So one of our models that we love, and she's already missed.
Already.
She was on the show 2 years ago.
Yes, talking about what he's talking about, cancer. That's why we do what we do, is to inform our community about health and what is going on with us. So I don't even know where to start with this young lady right here. You said I was going to do that.
Yeah, I told you.
So let me just have my producers to just put up pictures of my baby.
Mhm.
Yes. So the celebration of life for Sharita M. Tucker. And I tell the story that I birthed one daughter, and God took her away, but he gave me many, and there's so many of them that are so close to me. Look at that. I wanted that dress. But anyway, there's so many of them that I love to
That was at the post.
Yes.
Yeah.
I don't even know what to say. I don't even know how to say it. All I can say is I miss her already. I miss her soft voice calling me and saying, look at her. I miss this. I miss her saying she loved me, Miss Linda. I love you too. But this is Sharita, and she's amazing. She was in my second calendar. And I don't know if you all knew, and of course you can see now that we have plus size girls in swimwear. And did she feel that out? Look at all that boom to boom.
Was that? Where was it?
That was in Mexico, I think.
Okay.
It was. Yes.
Okay.
That one was in Mexico.
Mhm.
So I love these girls, and not just
Look her sweet
she
smile.
introduced me to Oklahoma. She introduced us to Oklahoma. So it's not too many people in Oklahoma that I don't know. And to know Sharita is to love Sharita. Whatever she had in her, she was willing to pour it into you. So Sharita, and to her auntie and her daughter, we're here for you. We love you. Auntie Shirley, girl, look at that. That was a nice hourglass, all right?
Mhm.
Nice. And she talked about her journey with cancer. And even up until the weekend that she passed, she was still committed to do some work. That you can't do nothing, girl, pass that on. But whatever she said she was going to do,
Committed.
she is, yeah.
A woman of her word.
Truly a woman of her word. Truly. There's so many people that this young lady has touched all over the world, not just our country, but the world. So my heart is to her. Her service is going to be Saturday in Oklahoma City. And I'll post the flyer information so that you all can know that LS 1426 company, team, models. We support them. Anyway.
So Linda and I talk every day, and she said to me, "What are we going to do for our 2 cents?" And I said, "We're gonna do a memorial, and we're gonna remember uh, Shay, and make sure that people are aware that she was here. She had a purpose. She did what she had to do, and then God called her on. But one thing we want to be clear, and we're committed to making sure that we give you cutting edge information when it comes to health and wellness. And it's all about making sure that we do the things that we need to do. This woman was on the show talking about her journey, and here we are now. So early detection is equal to prevention, you know, and we need to just make sure that we're getting this, that women get your wellness, your well women's done, take care of that, do it. Men, make sure that you get your colonoscopies. We need to do the things we need to do so we can be here to tell the story. There's so many babies behind us who need us. So their journey will be as smooth as ours because somebody was before us. So I take it I don't take it lightly that healthcare is important, and we need to really focus on making sure, and we need not ever forget those who came through and made an impact on us, because she definitely did.
She did. And when I was diagnosed with whatever I was diagnosed with, but anyway, when I look back on her journey, and then after I quit crying, and I had to say, Sharita lived her life. She just didn't exist. She lived. And you never knew that she was sick unless she said, "Oh, I don't feel good." And you're not going to hear her say that too many times. You didn't. And that's what I want to live. I want to live until he called me home and just find out what's going on so that we can take care of it. And that's why we had Dr. K on here, so that he can give us confirmation of what we need to do different with our body. He was able to say, don't do this. Well, we think milk does the body good. And here it is.
No, it does not.
No,
so you know, and
we need it.
Yeah, you know, and the beautiful thing about Dr. Kahlil is that he was able to really make it simple for us to really understand. It wasn't too heavy. It didn't get too fuzzy. It was right in our face. And, you know, listen, I stopped drinking milk for that very same reason, because I knew it wasn't doing anything for me. And so, and I've been feeling, my blood pressure has changed. Let me say that. And I don't know if cutting milk out or not made the difference, but I'm going to go ahead and claim it. Yeah. You know what I'm saying? So, you know, we just have to be conscious, you know, and continue on knowing that we're going to be okay as long as we have these dialogues. Don't forget the people who came before us, and know that we can be stronger as we bond together. That's what this whole show is about.
What's that say right there?
It says, praying for her and her family. Thank you, Linda and Barry. You all looking good in the white and black.
Okay. Thank you. You look nice. Oh, thank you. But it's read that one, Barry.
I am so thankful to you for this. Aunt Shirley, thank you.
That's Sharita's auntie, the best auntie in the whole wide world. We love you. Anything that 1426 can do for you,
whatever you need, right?
Exactly.
Do not hesitate to let us know if you need anything.
Please. So we thank you. We I don't want to cry. So anyway, I am a big water bag right about now.
Well,
and
that's our show tonight.
How about that? Okay.
We thank you guys for your continued support. You guys love on us. You return. Don't forget to
like, share, and subscribe. Like, share, and subscribe. We will
guarantee. Have a great week, everybody.